We see that written a lot. We've talked about it in a lot of webinars, but how do we actually do that? And how do we bring that to the point of care? We got to remember that if we go back to our Kaizen model of process improvement, we have to always go back to Gemba, and Gemba being the place where work takes place. And in a hospital, work takes place at the point of care, where the patient is. So we really need to go back and look at optimizing the environment where the patient care takes place. And we do that with the Revolution horizontal head wall by, first of all, giving the users the ability to get to and access the essential services that they need to provide care. That means electrical outlets, nurse call buttons, code blue buttons, all their gas services. They are at a plug and play height. They can walk up and they can access those without having to reach down ankle height, fight through stands, fight through cables to get to electrical outlets. We really need to rethink how we distribute our essential services as we design new environments. We also need to think about incorporating an equipment management tool, a rail system, that allows the users to be on-demand flexible in that patient room without having to call maintenance or housekeeping or facilities. They should be able to take a basket and move it out of the way to make room for something else that may come in the room. They need to be able to manage their nurse call and their telephones and all of their day-to-day use devices in ways not just hanging over the bed rail and not with the cables on the floor, so when housekeeping comes in, they just mop them over. They need to have tools to manage these things at the bedside and on demand. They need to have easy access to PPE. They need to have gloves at the bedside. They need to have wipes at the bedside. They need to be able to sanitize. We have mounts for sanitizing spray that they can do. So these are all part of the tools that will allow clinicians to be better at what they do at the bedside and more organized. And that's really what we're trying to do, is optimize their time there, because it's a very critical and high intensity, high acuity environment. The other thing that we learned from COVID-19 is that there has to be an immediate ability to expand medical gases in non-traditional rooms. And we can do that with the rail system as well. And the easy way to do that is we can simply insert what we consider a splitter block into any outlet. It can be any flavor of outlet. And I'm going to come over here and grab a couple of our block assemblies. And what this allows you to do is then put a gas block onto a rail and tie this with the hose into the splitter block. And then you have immediately on demand created 4 vacuum stations from where there were previously only 2 on this head wall. So now technically you have 5. You have 1 on the wall and 4 over here. And you can do the same thing with oxygen and air. So if you need to bring a ventilator in, you can on demand bring services in to meet the requirement and very easily ramp up for gases. So now we've created 3 oxygen with 1 over there. So there's 4 oxygen, 5 vacuum. We can do the same thing with air on demand without a long wait time. One of the things that we've learned from COVID-19 is that throughput from the ER and admitting patients right away to the ICU is a critical way to keep that ER open for new patients. And the faster we can convert patient rooms into critical care environments, the better for the whole process of healthcare during a pandemic crisis. To further accentuate the point about putting things on a rail and not mounting things onto the wall or on the ceiling, we've actually been able to take a Waldman Triangle minor surgery and procedure light and rail mount it. What this allows you to do is not only take it off and move it to other locations, but again, if you have to do a terminal clean, a couple of Allen screws and a couple of people, and you can lift this right off the channel. You can take the channel off the wall, and now you have the ability again to do a full and total terminal clean. The light plugs in. It is not hardwired to the ceiling. It is not hardwired in the wall. Actually reduces your cost of construction and your time of installation. You can now actually make this light as part of your FF&E budget instead of doing it as part of the construction budget, and make it one of the last things to be installed. So using the rail gives you a lot of different options, more from a construction standpoint than anything else, but also just reinforces the ability to do a total terminal clean at the end of a discharge of a patient. So as you can see from the light that we just demonstrated, no is never the answer at Paladin Healthcare. We can mount anything to the rail, from computer mounting hardware to patient mounting hardware, equipment management, supply management at the most basic or the most advanced levels. One of the other things that we can do is we can clean up the sink area and the PPE and the infection control side, again, on a user demand environment. So you come in, you get your soap, you use your paper towels, wipe your hands, throw it in the trash, use your wipes if you need to clean up the area, hand sanitize, get your masks, and go to your room. So you have the flow of hand washing stuff that you need as you walk into the room and as you move on to your patient. User defined, technology neutral, because it doesn't matter what brand you use. It's something that we can do very effectively. We have a lot of experience in this, and it allows you to manage the point of care environment where patient care takes place, because we always want to go back to Gemba. For more information, please look at our website at paladinhc.com. We have a COVID response drop-down on our homepage there with a lot of the information that I just showed you, not to mention detailed information on all the products that we have. Thank you very much.